Okay, hey guys, how are you? Good to see you again. Greetings from Tuscany, Italy. Uh, and today I have a very nice case for you. It's a really beautiful detail that it's very important for young surgeons to understand. This is something that we teach in the course, and it's a little detail, little, it's very small, but it makes all the difference. Okay, it makes all the difference. Um, so I'm going to show you the surgery, and when we get to the point, I'm going to stop. I'm going to explain a little bit. We're going to see that detail two times. Okay, so you can see it very well, and you can understand it. Okay, okay, guys, this is a beautiful surgery. I'm going to share now. Wait. Okay, here we are. Okay, here we are. We have the. We already made our incision, and we already injected trypan blue. So now we are going to perform our capsulotomy. First, you saw I um, just try to measure with my capsulotomy forceps to do it around 5 millimeters, and we go around. It cuts a little bit, guys, because of the Wi-Fi. I am, as you see, I am in the middle of nowhere in Tuscany, so it's kind of hard to get a nice Wi-Fi here. So we already performed our capsulotomy, as you can see there, and I'm measuring it. It's 5.5 millimeters, just nice and perfect capsulotomy. It's not always perfect, not even in my hands. It's not always perfect. You just have to be a good one. You don't have to be crazy about 5.5 perfectly round. Don't go crazy about that. Just have to be a very nice centered capsulorhexia. It's not perfect, okay? Just have to work. If it's not perfectly round, it makes no difference, okay? Okay, so now we're gonna go in. We're gonna go in. As you can see, I'm gonna jump ahead a little bit to the good part. I'm jumping ahead. Okay, here we are. I already cleaned the epinucleus. Okay, wait. Right here. It's right here. Okay. So now I am sculpting a pit. Okay, this is not a stop and chop. I am sculpting a pit, and I want you to see now what happens. Okay, I'm gonna come back again so you can see it. I'm going to stop. I'm gonna come back a little bit, because I want you to see very well what happens here. Okay. Okay. Watch carefully. I am impaling, and look what happens. It loosens. And of course, I can chop because I have experience and I do it mechanically. I don't need the holding power. And now I do something, and you see that it won't loosen. I impale, look, it grabs it perfectly. I have holding power. In the previous one, I didn't have holding power. And there's a little something I adjusted. And this is, I'm gonna come back again. Okay, wait, coming back. I want you to see it now, but with the explanation. Okay, wait. Pit, here's the pit, here's the pit. Okay. Okay, now we're ready to chop. Okay, so listen to me. This little detail is the difference, is one of the difference that we teach in the course of mastering chopping techniques. Okay, one of the differences that makes you an average chopper versus an amazing chopper. Okay, and here you will see that when I impale the nucleus, it loosens, and this is because the power of the tip makes a cave, and I have no tissue. It makes a cave. It emulsifies the nucleus, the tissue. So instead of grabbing the tissue, I make a hole, and I have no tissue to grab. So I have no holding power. I hope it's okay. The explanation is okay. But in the next move, I noticed this. You have to notice. And to notice, you have to know. And to know, you have to have someone that shows you and teach you this. Okay? In the next move, whoop, that's a big mosquito. I am diminishing the power so I don't make a hole and I get good holding power. Okay? Now we're going to see it again. Okay? Okay. Here we go. Here we go. Now, check it again. I impale. It makes a hole because I eat all the tissue. So I have no holding power. Then I stop. As you can see, I stop. I am speaking to my FACO machine guy or girl. And I told her, please go to 20 in the power. And now you can see it makes no hole. It doesn't loosen. It gets good holding power. And I can chop easier. Okay? Did you see that? Okay? And now the rest of the case is easy and I can chop. And perhaps you can say, okay, Luis, but we saw that in the first chop with the hole and no holding power and all this blah, blah, blah you're telling us, you still did a good chop. Yes, but I did, and it was a mechanical chop. It was all mechanical, but because I didn't have holding power. Okay, I didn't have holding power. But this is a soft cataract, and these are even more difficult than hard cataracts because this you lose tissue very easy and you have no holding power. So this tip I am giving you now is so important in kind of soft cataracts, not soft but kind of soft, because these are the more difficult, and this is a variant of the posterior cataract. This is another kind of cataract. I have never seen this described, this posterior nuclear cataract, anywhere. I haven't seen that described anywhere. And this is one of the most difficult type of cataracts and is kind of soft. And this is how to conquer this. This is how we teach what we teach in the course. Okay? So now we're finishing the surgery, as you can see, very easy, very, very, very slow finishing, nothing very interesting here. We are aspirating the cortex, as you can see. I am aspirating the cortex and then injecting the IOL. You can see there the IOL perfectly centered with the rexus perfectly centered, all good, all nice, all smooth. And we're going to pause and come back to you. Okay, guys, so this is gold, believe me. This that I just show you is gold because a lot of surgeons do this because they kind of know this in an automatic fashion in their heads. But usually, surgeons, we don't have the way to explain it as good as we explain it now in the video. And this little tip is gold. So I hope you enjoy it. I hope you can use it with your patients. And I hope this make your cataract easier. And I really hope that this contributes a little bit more to make you a fantastic chopper. See you guys. Greetings for Italy. Cerramos, chiringuito.